That's it. Back to the, yeah.
Just back to the main page, yeah.
Okay.
So good afternoon. As Claire said, I'm Belinda Stokes, now the menopause nurse for Here for Each Other, Dorset's enhanced staff wellbeing service. I have broken this down. I don't know whether it was advertised as the physical symptoms, but because there are so many physical symptoms of the menopause, I'm broken it down into different subjects, and so what we'll do is we'll do other sessions with some other symptoms as well, I think. But I just thought this topic is really important as well, and it's not really sort of spoken about, because I think women find it embarrassing, and also think that, it's just an aging thing and we have to live with it. So we're going to discuss the symptoms of perimenopause and menopause, and that's vaginal atrophy and urogenital symptoms. A lot of women find it extremely embarrassing to talk about, and as a result, they do not seek help or advice. And studies have shown around 70% of women have urogenital and vaginal symptoms in menopause, yet only 7% receive treatment, which is quite shocking, really. And the reason is because we have estrogen receptors present in the vagina, the urethra, bladder, trigone, and pelvic floor, and all of these areas can be affected by a lack of estrogen during the perimenopause and menopause. And during this stage of our cycle, the estrogen levels decline. And what estrogen does is it keeps your vagina healthy by acting as a natural lubricant, and it also stimulates the cells in the lining of your vagina to encourage the presence of good bacteria that protects against infection. And the tissues, they become very thin and more sensitive with decreasing levels of estrogen. So the common symptoms include vaginal dryness, soreness, irritation, burning, itching of the vagina and vulva. It can become very red and inflamed. There's decreased lubrication during sexual activity. You can get pain and discomfort during sexual activity, sometimes post-coital bleeding. You get urinary frequency and urgency. And a lot of ladies say that, they've been out shopping and they just get to the door and they just can't wait to get to the toilet. And sometimes they find it difficult to hold on and have some leakage when they've never experienced that sort of thing before. And recurrent cystitis and urine infections. And they're often prescribed antibiotics by their doctor, and it's not really resolving the issue. And they've tried different antibiotics and still not resolving, when really they need the estrogen to be replaced. Many women find they experience symptoms at other times. For example, when they're walking, running, cycling, horse riding, or just sitting down can be uncomfortable for some women, and wearing tight clothing, jeans. And quite a lot of women avoid going for cervical screening because it's just too painful. So what can be done? So there's various different treatments that are available. They're very different from systemic HRT because they're very low doses. There's no risk to the endometrial lining of the womb, so you don't need to take an additional progesterone tablet for that. And there is no evidence of increased risk of breast cancer ever been found in studies. It's such a tiny amount of local estrogen. So the different types are local or topical estrogen. So this type of estrogen is applied directly to the affected area and it's not absorbed into the rest of the body. So it's not the same as the estrogen you take as part of your systemic HRT. It doesn't go into your bloodstream. And vaginal estrogen treatments can be taken safely for a long time with no associated risks. The preparations are available on prescription, and your healthcare professional will discuss with you which type is best for you or which preference you have. There are three main ways to absorb the estrogen directly to your vagina and surrounding areas, and we'll have a look at those now. So the first one is a pessary. Some women find with severe symptoms they need to use the pessary. The first one is Vagifem. It's just a small tablet, and it's in the end of that little plastic applicator that you can see there. And you insert it into your vagina via the applicator. It's used daily for the first 2 weeks as like a loading dose, and then twice weekly after that. Some women with severe symptoms find they may need to use it more often, sort of 3 or 4 times a week, and it's very safe to do that too. And this is the product, I don't know if people have heard recently in the news, that it's just become available to buy over the counter by your pharmacist, and it's called Gina 10. However, it's only available to buy this way if you're over 50 years and you've not had a period for at least a year. And there's also a very long, I had a look, a very long questionnaire that needs to be completed by the pharmacist prior to buying it. But you can, as I say, you'll still be able to get it on prescription. I think it works out, I think I had a look, it's £30 for 28 tablets. So that if you had 2 a week, I think it would last you 3 months at £10 a month. If you buy it over the counter. And there's another product called Vagirux, which is the same as Vagifem, but it's a single-use applicator with a pack of 24 tablets, so it uses less plastic waste. So instead of having one of those for single use, I think you get an applicator, and then you put a tablet in that applicator, use it, and then wash it, and then you can reuse it. And then the next one is Invagis. These are pessaries. They're a lower dose alternative, and they look like small little waxy bullets. You don't have an applicator for insertion, so they're more environmental friendly. They can, however, sometimes result in a discharge when the product dissolves and leaves your vagina. One pessary is used every night for 3 weeks, and then twice a week after that. So it's all about preference of how you want to apply these. And then there's another type of pessary that's non-estrogen treatment. And this is called Intrarosa. And this differs from the other two because it contains DHEA, which is a hormone that our body naturally produces. And then once it's positioned in the vagina, it converts to estrogen and testosterone. And it can be used with or without an applicator, and the usual dose is 1 pessary every night. There is another option of I think a newer option of a tablet, and that's for women who don't want to take anything vaginally. It is non-hormonal, and it can be used in women that have had breast cancer once their cancer treatment has finished. It doesn't contain any estrogen. And then the other types are creams and gels. So there's Ovestin, and that's applied inside the vagina on a daily basis for the first fortnight, and then twice weekly after that. There is an applicator that you can use to insert the cream, or you can use your fingers on and around the vulval area as well, which can be quite useful if you're experiencing itching or soreness. And then there's Blissful Gel, which is a newer product that contains estriol. And again, that's a lower dose option, but not quite as low as the Invagis we were talking about earlier. And that also has an applicator to insert the gel inside, used every night for 3 weeks, and then twice a week after that. And the last way is a ring. So it's an alternative way to use vaginal estrogen is with the ring, such as E-string. It's a soft, flexible, you can just see it there in the picture, a soft, flexible ring that you insert into your vagina, and that releases a slow and steady dose of estradiol over 90 days. So therefore it needs to be replaced every 3 months. You can either insert it yourself or get your health professional to do that for you. The dose released is slightly stronger than the Vagifem pessary, and women can leave the ring in position to have sex, or it can be removed and reinserted themselves if preferred. And then the other non-hormonal products that you can use that can help with dryness and itchiness, vaginal moisturizers. They're much like moisturizing your face. These act on to keep the tissues well hydrated and feeling less sore. They're used daily, and the moisturizers are used daily. The lubricants are used just before having sex. And there's several recommended brands of moisturizers and lubricants, and your healthcare professional pharmacist can advise you which is best for you. That one there on the screen, Silk, that you can get that one on prescription. And then the other products that are mostly recommended are products made by a company called Yes Organic, and they're organic, and they do a water-based, they do a vaginal moisturizer, they do a water-based lubricant and an oil-based lubricant. But just remember, don't use the oil-based lubricant if you use condoms, as it will dissolve the latex in the condom. And these can be obviously used alongside the estrogen products. So, improvement of symptoms. Symptoms of urogenital and vaginal dryness and discomfort should improve after about 3 months of using vaginal estrogen treatments or moisturizers. And it, as with all, medications and HRT products, it's just a case of trying which product you find that suits you. Some women, find they may need to use one type inside their vagina and a different type on the outside. If you haven't had any improvement after 3 months, then you should get a review from your doctor or healthcare professional, as sometimes, rarely, these symptoms can be due to other conditions. And there is another condition called lichen sclerosis. I don't know if any of you have heard of that. It's not thought to be hormone related. It's very similar to the symptoms of vaginal atrophy, and but it happens more common around the time of menopause. It's thought to be autoimmune in nature. There's not really a cure for it, but treatment is steroid ointment. And you can use, as I said before, you can continue to use the treatments long term without any risks. And if you stop using them, your symptoms will return. And also remember, if you have any unusual bleeding, this needs to be reported to your doctor. And then the other thing we can do is self-help, is doing our pelvic floor exercises that can help with urine leakage. And doing these exercises 3 times a day can significantly reduce leakage. There's some good apps to help you with that. There's such as the Squeezy NHS pelvic floor app, and that you can make an exercise plan on that, and you can create a bladder diary, and you can set reminders to do your exercises. And then when you go on the app, it times you holding your pelvic floor for 10 seconds, releasing it. And then, but if urinary symptoms are very troublesome, you can ask your doctor to refer you to a pelvic health physiotherapist, who she'll do a full examination and check if you have any pelvic prolapses, and make a plan of care for you. They're really knowledgeable and really good. And I was just going to say, if you're having several products on prescription, then I would consider getting a prepaid certificate, because that will cost you £10 a month. You can pay that direct debit via the NHS Business Services Authority website. Otherwise, it can be quite costly, all of these. And then we can go to questions and answers.